Professor Temitope Alonge, the chairman of Oyo State COVID-19 Task Force, says the Infectious Diseases Centre in Olodo, Ibadan, currently being used for the treatment of COVID-19 patients, will be transformed to accommodate other forms of infectious diseases.
Coronavirus, but then it can accommodate any other form of infection. Part of the upgrade is also to, more or less rejig the setup. So we're moving everybody to the green zone, such that the red zone has a section of it which we classified as blue zone. So patients who come in and they're having the results of investigations are not out, and we're not sure where they are, and we don't want to discharge them to the community because we don't know what they're coming with. They can stay there. It's more like an observatory. So we've created an observatory now out of the old pharmacy unit, and so we have more than enough room now to take patients with different kinds of infections.
In his remarks, Dr. Idris Fasasi, the Chief Medical Director of the Centre, said 25 COVID-19 patients had been admitted and treated in the centre since the beginning of the fourth wave of the pandemic. Fasasi said 15 of the patients had been discharged, while the remaining 10 were still receiving treatment. He said most of the patients were Omicron infected.
We have had, so far, 20 to 25 cases. Okay. Some have been discharged and in the world now we have 10 people currently isolating in the center. Most of them are Omicron. Most of them are Omicron, but from the literature and what we have been told from WHO, Omicron is mild in severity. It's not as severe as Delta variant that we experience in the past. Not that there is no Delta variant, but Omicron now are more in the community than the Delta variants. What we find out during the third wave was most of the patients have, with the coronavirus, they came down with kidney problem. And because of that, we find it difficult to send patients outside for dialysis. When patients have elevated, when their urea or creatinine is elevated to the extent that they need dialysis and they have COVID, most centers will not take them, maybe because of stigmatization. So, and the center we can refer to for dialysis outside your states, probably they beat them exorbitantly. So this center have gone ahead to have a dialysis unit whereby our patients that have kidney problem and they have COVID are being dialyzed here. So that won't give a succor. We don't need to be looking for center to dialyze COVID patients and where they will be paying exorbitantly. We've done first one already, and we are doing the second patient who have kidney disease and need dialysis, and the center have COVID in addition to that. So we are going to dialyze the patient at no cost.
On how to further curb COVID-19 transmission, Fasasi advised the public to strictly abide by the COVID-19 protocols and guidelines.
The first thing we should do is that we should go for vaccination. Well, either AstraZeneca type or the other type. The protocol in Nigeria is that anyone that's above 18 years old should go and get the vaccine. We should ensure using our nose mask regularly and maintaining social distance at least 1 meter apart as recommended by WHO, so that we can break the chain of transmission of the virus. Then, most important is washing of hands with soap and water. It has been known that washing hands with soap and water will remove the virus from our hand, and we should prevent ourselves from shaking hands. We can use our elbow or even wave to ourselves when we are greeting instead of the conventional shaking of hands. All this will actually break the chain of transmission of the virus.